Hello and welcome to this latest version of the Bytes podcast. I'm Robert Knott. I head up the Bytes healthcare team here. Today we're here to talk about data assurance, and I'm joined by
Rich Feltham, so I'm the blue light lead for IBM Storage in the UK.
And I'm Fraser. I'm a multi-cloud architect at Bytes.
So guys, we're here today to talk about data assurance across the NHS. First thing that brings to mind really is that's quite a broad topic. So, I mean, Rich, maybe you could just kind of give us a summary as to what you see data assurance to actually mean.
Yeah, sure. So for us, data assurance is kind of an evolution. So, I come from the storage world. I've been in storage for I'm in my 25th year. So we've gone through that kind of concept of protecting data, whether that's through high availability, disaster recovery, traditional kind of storage level things. And then, with the onset of cyber attacks and more recently cyber terrorism, what we're finding is that there's more and more prevalence of storage needing to provide capability in cyber recovery in particular. So you have data protection, which has provided that, and you have immutability, which provides you ability to be able to recover, keeping a safe copy of your data. That's great, but at any one time, an organisation doesn't really know what level of risk they're under in terms of how they can recover. So you'll probably heard of cyber resilience or cyber recovery. So data assurance is a kind of another level on top of that. So it's looking at that ability to be able to secure your data, recover your data in the right way. But it's also thinking about how do you look at the active and dormant threats that you have in an organisation to understand your level of recoverability. So how can you recover? And what level of risk you're under at any one time should you need to recover. So that assurance is the ability to be able to look at that holistically and decide how do I put the right capability in place to ensure that I know at any one time if I'm being attacked and how I'm going to recover in the event of an attack.
And I think for me, I mean, that's something that we probably hasn't necessarily, the evolution hasn't got to yet across the NHS. I think probably the wider customer base. You're having those conversations?
Yeah, actively having those conversations with people, because the reality is, to Richard's point, that we've got an immutable copy and we'll trust it, and we might do a monthly restore test, but there's no certainty for people at the moment that they can actually recover when that system goes offline in the event of a cyber incident, which, to Richard's point around being in storage for so long, actually that's generally what brings things offline these days, because the kit is so it's so reliable, and most vendors are delivering 6 nines anyway out of the box. So that losing a controller or losing disks, bringing the storage offline, that actually isn't as much of a risk anymore as the cyber problems that we're seeing out in the market.
Yeah.
So what we're really talking about here is an insurance policy.
Yeah, because one of the first things we have to get, and any organisation, but NHS in particular, because they're under probably more risk than everything else. We know that healthcare globally is attacked more than any other industry. So what we have to get them to understand at the beginning is cybersecurity. They've spent lots of money on it. NHS have good funding. They have good interaction with NHS England, but cybersecurity builds you a wall, and you can build the highest, tallest, thickest wall in the world, but someone will get through that wall. And it's getting them to acknowledge that they're either going to be attacked, or they might even be under attack. There might be some dormant threat there already. So once you get the organisation to understand that, okay, I need to go with the mindset that someone will get through, to about how much I've invested in my cybersecurity, they will get through. So how do I mitigate that risk of recovery? So, it's talking about, generally storage is very reliable. It is. But once you have a cyber threat, then the recoverability of that storage becomes crucial.
Yeah. Yeah, totally. And I think, to your point around healthcare, and Rob, you'll see this as well, I think what's worse for me is when you're building these solutions is that you've got almost a third degree involved, and that's human life at the end of it. Patient care is affected as soon as the system goes offline, and you could then see deaths on as a result of that. And I think for me that brings it brings an extra degree of assurance needed around those sort of systems.
There's criticality there for sure. And there's lots of examples. We know recent examples of where that's happened in South London not so long ago. That cyber attack which had a massive impact for a long time, and they're still having the impact now. So we know we don't have to look far for an example of it, but it's trying to get that organisation to understand, okay, but the threat is there. I need to do something, because threats are always ever going to increase. So it's what do I do to ensure I mitigate? So for us, it's all about that, thinking about that, that threat detection, whether it's dormant or active threat detection. That's vital, because that tells you where you are and what state of recoverability you have. Because a lot of those attacks that happen, a lot of the cost, whether that's actual monetary cost or cost of impact to healthcare, is all about that recovery time. The worst example is a couple of years ago that the Irish Health Service, HSC, they were attacked in April with a €20 million ransom, and it took them until August. They'd only recovered 95% of their data, and the cost was over 600 million to that organisation. So that's kind of the far extreme of examples, but it can happen. And that elongated time to recovery, that's what has the lasting impact. Speaking to a customer of ours who had a very short outage of only a couple of hours, but the impact of that led to operations and appointments that led out to 6 months. So a very small outage has a massive impact. So if you can reduce that time to just recover, or reduce that time to knowing you're under attack, and reduce that time to recover, that has a massively positive impact to the organisation.
I mean, both of those examples are a real life and literally death kind of situations, right? And the financial implications is interesting you mentioned that as well, because actually it's not that initial ransomware threat and you need to give me X, Y, and Z. It's that long-term cost, right? And cost of recovery. I think what I'm interested to do is almost learn around some of those solutions that we can put in place to reduce that time to get your environment back up to being live and reducing, as you say, reduce that time that all of our families are going to have delays in seeing their consultants and getting their pathology results in, for example.
Yeah. So that evolution is also about the technology evolution as well. So the secure copies, the immutability, the protecting the data, having multiple copies of it. That's something that every organisation does, as a matter of fact, and every NHS trust does it. The areas what they don't normally do is in that active and dormant threat detection level. So we've introduced a capability for active threat detection on our primary storage systems. So as data is written into that primary storage system, we're actively looking for potential threats. So that's like within seconds of a potential attack and notifying and integrating with the security operations, whether that's a SIM or SOAR, whatever security ops an organisation has, to be able to then act upon it. So that's vitally important, that active threat detection, doing it very, very early in the process. And then the other kind of bookend of that is the dormant threat detection. So we have a capability in there to have a clean room where we take backups and look at those backups and interrogate them for potential threats. And if they find threats, clean them and then carry out the whatever policy is needed to recover the production system.
That's that dormant threat you mentioned, where it's it's almost hiding away in the cupboard, ready to strike. Yeah, the shadows.
Yeah, because we know that threats can lie dormant for up to a year in organisations, and normally the threat vector is going to be the data protection environment, because that's the one that those bad actors want to go and try and disable. Because if you disabled your backup environment, you can then slowly over time infect all of that backup to the point where when you actually instigate the attack, you've got nothing to recover from, regardless of whether it's immutable or not. You've still got nothing to recover from. So having the ability to be active in your threat detection, but also dormant, so keeping the lights on as much as possible, It reduces that risk, reduces that time to acknowledge an attack, and ultimately reduces that time to recover.
I think the worst case scenario to being in that situation is you recover and you think you're fine, and 2 weeks later you find that your environment's infected again, and then and that's all because we trusted that backup because it was immutable. We didn't know whether it had a threat inside of it or not. And no amount of cyber security solutions that you've got in place is going to tell you that when you actually come to do that restore. So I think it's really important.
Yeah, because we know if we ask an organisation, and this is any NHS trust or board that you go and speak to, if you say, if you are attacked now, how would you recover? Now, some have a recovery plan that's driven a lot by security, but there's no degree of the sense of recoverability that they have. It's very much, it's going to be, it will be a best effort. So as a business, you think as a trust as a business, then that's an incredibly high level of risk. So why not implement something that gives you that ability to show at any point in time, a dashboard view of what your level of recoverability is? And that's fairly easy to implement. You can implement some software that delivers that for you. That has got to be a massively positive outcome from going from not having any idea of how you can recover or what time it's going to take you to recover, or if you can even recover at all, to knowing how quickly you could recover in the event of attack.
It really brings those teams together as well. I think historically we've seen data center teams working in silo and security working to protect, but as you say, building that wall up, this feels like an area that really pulls it all together. Some good collaboration for not only just storage and security, but bring it all together. And it feels like a really interesting topic that probably isn't that prevalent yet, and one that all NHS trusts and NHS entities want to be talking about and reviewing right now.
Yeah, I mean, we feel we're at the forefront of this for sure. Not many talk about data assurance. They talk about data protection or data resilience, or cyber resilience. That's all important things. That kind of next level, I think we definitely got a march, and we understand the level of risk, and that integration with cyber, with SecOps is massively important. The storage is becoming more important in that kind of detection level. We talked about that kind of active threat detection, but generally, anomalies of data that's detected by storage systems is vitally important to be passed up to security into that SIMS or whatever SecOps they have to trigger action. And that's never been there. That's only in the last kind of year that's really possibly been there. And we feel we're at the forefront of that. So you have that full integration between security and storage. You keep building the capability of what storage can detect. You add that capability to be able to look at how you can recover. That gives you a holistic kind of view of cyber resilience.
So I think a lot of people listening to this podcast might be thinking that this all sounds great, but what's my barrier to entry? And I imagine, Rob, you're listening to customers at the moment who are budget strapped. So, Rich, where's people's barrier to entry for this technology?
Yeah, I'd love to go into any trust and say, look, rip out everything you got, put IBM in.
Yeah,
and that'd be great. We'd all love that. But in reality, that's never possible, and the NHS is always under budget constraints, and never more so than now. But there's ways to kind of enter that journey, which is fairly kind of low cost or low kind of low weight, and that's to look at that kind of clean room concept. We partner with an organisation called Predator. They're unique in the market. They provide a platform agnostic cyber resilience orchestration capability. So what that means is they have a clean room capability which they integrate with your data protection environment. It doesn't have to be an IBM one. They work with other vendors as well. But they interrogate that backup. So they're doing that dormant threat detection. So they're looking at those backups. They're using standard antivirus tools, pulling it into a clean room, cleaning it if they need to, but periodically checking all of those backups, and then understanding, using a dashboard for that level of risk. So that was talking about that kind of dashboard of risk. That's what Predator's delivering. Now that's SaaS, and you can deliver that at fairly low cost. It's licensed on a per terabyte, whatever, of whatever data protection environment you have, so you can deploy that quickly and easily. We know organisations that have deployed it, and they've very quickly seen an advantage of what that brings, and actually seen those dormant threats that are there that the organisation didn't even know existed.
So we've had some wins as quick as that. We've had trusts that have literally deployed this out, and then all of a sudden they've spotted the issues at that quickly.
Yeah, within days, and they're finding things that they never knew were there, and they might not have been and turned into an active threat. However, they're finding anomalies in the way that their data is presented. So yeah, quick value for not a lot of outlay in terms of money and time.
And who doesn't want to buy a tool that's called Predator? I mean, we're all going to feel safer and sleep better at night, I think, with a tool called Predator.
That running in the background.
Yeah.
Keeping you safe. Yeah, absolutely.
So, I mean, you think of topics of assurance, and then you instantly think along the lines of insurance. I mean, is this going to be an area that is going to become a tick list on cyber insurance policies that all entities are going to have to undertake?
Yeah, and it's coming, right? And we've seen it already that there's not many providers that are providing proper cyber insurance, but many have very stringent requirements when it comes to that. There's nothing around data assurance, but they definitely you have to ensure that you kind of follow a model, and that model is normally the NIST framework, which is now an internationally renowned kind of framework. Yeah, the NIST framework, so identify, protect, detect, respond, recover, and the respond, recover bit is what storage has been doing traditionally, and the rest is what security has been doing. But that insurance agencies are using that as the kind of the framework as well. It will come a time, especially in public sector, where that requirement will be driven for sure. So organisations will need it, but it's kind of why not? Why would you not want to have that level of understanding of how you can recover and when you can recover? Because if you don't have that, the organisation, the trust, is always going to be under pressure to not really know what happens in the event. And at the end of the day, the NHS is providing patient care, and it's a risk to patient care to not think about that.
Oh, yeah, I mean, I think in an area of healthcare digitalisation, we're going to get to hopefully a position where, all paper records are gone and the system is more integrated, but that in itself drives even more and more data. So anything that causes an outage and downtime is a real risk. I've learnt loads today, and I feel like it is a topic that as you say, lots of people on the podcast are going to learn about and want to take further action on.
Yeah, totally agree. I think this is like we've all spoken about today, it's an emerging topic, and it's going to keep growing in our spaces. We need to keep an eye on it, definitely.
And there's things that organisations can do to kind of understand their level of risk, where they are. We have a free cyber resiliency assessment, which Bytes can deliver into an NHS organisation. And that identifies gaps and weaknesses. Also shows their strengths, because many NHS trusts are doing doing lots of very good things when it comes to cybersecurity.
There's loads of great work out there at the moment.
Yeah.
But it's almost like there's so much, isn't there?
Yeah.
So I think any kind of service that helps identify those gaps is great. And like you say, we do want to shout out the good bits that are happening as well, right? And not forget.
Exactly.
You don't end up leaving here all thinking this is all doom and gloom and the world is ending.
Yeah.
So I mean, what other kind of elements does that assessment uncover?
So it is looking at gaps in their recoverability in particular. So it's a storage focus. Even uses that NIST framework, and it splits out into those kind of 5 areas. But it's very much around what the storage and the infrastructure is doing to complement their security posture. So it's not looking at what cybersecurity they have, or what gaps they might have in that cybersecurity. It's all about thinking about their infrastructure and their recoverability based on those kind of 5 layers. So it can quickly identify to them where they need to fill those gaps and how. Obviously, that's where we come in to show how they could fill those gaps. Now, it could be through better process. It could be through better integration between security and IT, or it could be the implementation of capability. to deliver that.
Yeah, I mean, as I say, I think a topic that all of our healthcare customers and, dare I say it, some that don't work with Bytes right now would be interested in undertaking and having
Agreed.
a further conversation with us.
Certainly.
Cool. So lots of great areas of discussion there and loads of key topics. I think my takeaway today has been that we've had loads of conversation around security. We've had loads of conversation around backup. I think immutability has been something that people have been talking about over the last 18 months, 2 years. It feels to me like this is the evolution of that and the next step of, actually how do you then know we've done all those good security things and how do we bring it back and the speed at which we do. And those real life examples that you've mentioned, Rich, really bring that to life. Interesting to hear what your guys' key takeaways are today.
Yeah, so for me, it's for organisations to take an honest look at their level of recoverability. Now, they might have lots of tools and capabilities in place, but to have an honest look that if I was going to be attacked today, how long do we think it will take to recover? Because you can guarantee that there'll be a myriad of different results. So take that honest look and then look at how you can find a way to mitigate and come and talk to us because we can help.
I think for me, for all too long, we've spent a lot of time in this cyberspace talking around protecting endpoints and protecting server infrastructure, but just at the application layer, and that sort of taking a step back and actually implementing some protection at that storage layer, at that backup layer, from a cyber perspective, should only be something that everybody's concerned about and should grow in the market. And I think if I put myself in the shoes of a CISO or CTO inside of these NHS trusts, as an example, I would sleep better at night knowing that I could actually recover when I needed to. So I think that's my key takeaway from today.
That's a good point. I have got images of you now laying in bed and getting the phone calls. Get us back up online and we're under attack and you're right.
Been there before, and it's not
you
nice.
want CIOs, CTOs, don't you? You want them laying there going, no problem, we'll be up and running by the time I've hit my cornflakes kind of thing.
Exactly.
That's a really good point. Well, both, thanks very much for joining us on this version of the Bytes podcast. If listeners out there want to learn more about this, it'd be great if they reach out to us either via LinkedIn or via the usual route to our Bytes account managers. But yeah, thanks again both.
Thank you.
Thank you.